Welcome back to Morning Break, and this week's Monday Motivations brought to you by Gates Brain Health. We're so excited. We've got Dr. Randall Gates, a board-certified chiropractic neurologist and chiropractic physician, back with us talking about something I had never heard of, which is called, and I just lost the name of it, peripheral neuropathy.
Peripheral neuropathy,
That's it.
yes.
Yes, what is that?
Peripheral neuropathy is where your nerves are basically dying or degenerating in the peripheral nervous system. So it's a wide spectrum of disorders. Usually when we say peripheral neuropathy medically, we're referring to a condition called distal symmetric polyneuropathy, which means it's on both sides, it's kind of symmetrical. Technically, carpal tunnel is a peripheral neuropathy as well. That's a mononeuropathy. But the technicalities aside, most people think of it as numbness or tingling, burning, weakness up to the knees, can involve the hands. That's the generality.
Okay, and this is typically something that affects older people?
Typically, yes.
Okay, okay, and then the difference between that and the other one that we were talking about in the past
Lumbar stenosis.
Yeah.
So lumbar stenosis is confusing because given the age demographic, arthritis is not uncommon in the lumbar spine. So someone can have degenerative joint disease in their lower back, arthritis, which can impinge upon the nerves, mimicking a peripheral neuropathy, or someone may have both conditions at the same time.
Okay, so it's important to know the differences between the two, and if you have any questions, of course, go and see your doctor and get some tests done.
Yeah, absolutely.
And so one of the things that I think is interesting with this is that this is something that affects older people, but is it something that is caused by something specifically, or is it just kind of as we age, this can happen?
So with peripheral neuropathy, half the time it's due to diabetes. Basically, the high blood sugar attracts water into the nerves, causes the nerves to swell, and basically die through time. And there's a lack of blood flow component too. Aside from diabetes, the other half, there's like 80 to 100 different causes. And within that grouping, there are bigger causes or more common causes. So gluten is actually a really common cause in that other half of peripheral neuropathy cases. Prediabetes is common. Even things like vitamin deficiencies are important. Screening for bone marrow conditions are actually really important as well.
Okay, so when I think of damaged nerves, I don't really know of anything that like cures damaged nerves. Do a lot of doctors then just kind of prescribe something to manage pain and symptoms? Is that normal?
Exactly. So that's the overall medical opinion, is that they would give people medications to minimize their symptoms. For those who have primarily numbness, now, you know, the meds may help the numbness a little bit, but it's not as though they have severe burning pain, where the meds may help a lot.
Okay.
Or the meds may not help with weakness.
Okay.
And that kind of brings me to the point of University of Utah. In their neurology center, a couple neurologists started studying peripheral neuropathy and found that a lot of peripheral neuropathy cases that are not due to diabetes actually have prediabetes. But it won't show up even on your standard pre-diabetic lab test. So you're going to think, okay, well, my blood tests were normal. Well, it's a very specific type of test that they used that they found caused or showed that these individuals had pre-diabetic peripheral neuropathy. Anyways, they also showed that if these individuals really exercised and watched their diet, they could improve nerve regrowth for the small fiber nerves.
Oh, okay.
So I'm not saying that that's a cure for all types of neuropathy, but it is a window as to maybe what is possible.
Okay.
Because a lot of people feel helpless out there.
Yeah, and that's where you guys come in at Gates Brain Health, because those are tests that you run, those kind of
100%.
really specific, localized, focused tests.
Yeah, very in-depth workups, nuanced to the person's condition.
And then you also have told me that B12 vitamins are something that can also help. Why is that?
Well, B12 when deficient can cause peripheral neuropathy as well. Most people with neuropathy start taking B12 even though it may not really fix their issue. But it is important to assess for, because not only can B12 cause neuropathy, but diabetes meds lots of times deprive the body of B12 or our ability to absorb B12. Even antacids, so the Prilosec, meds like that, may inhibit the absorption of B vitamins.
Okay, so that's really good to know, and those are things that you can test for specifically at your clinic.
Very easily, yes.
Okay, perfect. So if anybody has any questions, how can they go and find you?
GatesBrainHealth.com or 775-507-2000. Give us a call if you have any questions.
All right, perfect. Dr. Gates, thank you so much. We appreciate it. If you guys don't need to suffer anymore, if you guys are in any sort of pain like that sounds very familiar to this, then definitely go and see Dr. Gates. We'll be right back.